Yeah,
this
just
morning.
just invest. Of course, it's on the Health Vibes ad. It's Trudy, Jacinfa, and Carlton. When people hear Carlton, they know it's Carlton. They know it's Carlton. When they hear me, they sometimes they say Jacinfa. But yeah, so it's been a while since we've had you on Health Vibes. But of course, with Carlton being on leave, you're going to be gracing the
Oh,
studio.
yes, I will be.
Yes, for the next few weeks. So our listeners have to get reaccustomed to Jacinfa Fig and Defo on air. Jacinfa, I know at Jolly's you all are very proud.
Oh, yes, yes, yes.
There was the Dominica State College graduation last week, and I know that we have some Jolly's pharmacists, brand new pharmacists who graduated last week.
Yes, certainly true. I mean, we are bubbling with, pride and, we just want to congratulate three of our very hard-working new pharmacists. So that's
Mhm.
Leona, Dahlia, Jeremiah, Krista Copel, and Mahira Edina John Baptist.
You have the middle
Oh,
names.
yes, yes, yes. I don't want to miss out anything. And, personally, I really want to congratulate the three of them. I have known them for a couple of years now, and they are truly hard workers, very dedicated, and very intelligent and ambitious young ladies. Not only to them, I want to congratulate the entire class, of those who graduated alongside with them. This is a career that is very fulfilling.
Mhm.
It's a career where you have to constantly be reading, updating yourself of new information, drugs, and what's been new in that field. But for Leona, I really want to signal to her and to her family, how proud we are, especially as she cupped a number of awards
Mhm.
for her graduation. So, firstly, she topped her class and the faculty. She also got the award. Let me just make sure. Okay, so she got the award for winning the Chinese Ambassador Scholarship Award. That's one. And she also got the Magna Cum Laude. That's another one.
Magna cum laude. So
Cum
she
laude,
graduated with
sorry. Yes,
honors.
so
Yes.
she did.
Hmm.
For academic excellence as well. So she has a number of awards under her belt. So to you, Leona, and she is actually with us this morning. You will hear her a little more into the show.
Hmm.
So kudos to you, kudos to the three working with us at Jolly's Pharmacy, and to the entire class who graduated.
Hmm. And this particular class, I taught this class, so I know we have some good pharmacists joining the team of
Yes.
local pharmacists. And the Jolly's team is always a strong team. So big up, of course, to the pharmacists at Jolly's Pharmacy and our new pharmacist, Leona. Um,
Dahlia.
You want me to say the middle name? Leonard, Leonard Dahlia, Jeremiah,
Jeremiah.
Mahira, and Krista
Krista.
as well, always at Mega. So, good morning and congratulations to you guys. This morning we have a very interesting topic lined up. I believe if you were listening to radio yesterday, or if you were in tune with anything on social media, you would have seen that yesterday was World Mental Health Day. It was being observed as World Mental Health Day, October the 10th. So we have a very interesting topic and a very interesting set of guests this morning with us to be talking about our topic. So what I'm going to do, I'm going to take a quick break, and when we get back, I will let you know who we have in studio with us this morning and what are we going to be talking about.
Introducing Jolly's Pharmacy, brand new website www.jollies.dm. It's your time to jump the line. Shop now at jollies.dm and have your items delivered in the comfort of your office. No more standing in line. No need to use your lunch hour to shop. Hassle-free shopping, safe and secure. Jollies.dm features rush delivery, 1 hour. In-store pickup, regular delivery, 5 p.m. Cut-off time, 4 p.m. It's your time to jump the line. Visit us at www.jollies.dm. Jollies Pharmacy, leading the way in healthcare.
Who say health cannot have vibes? Well, Jolly's Pharmacy is proving you otherwise. With Health Vibes, every Wednesday morning on Q95 from 10 a.m. to 11:30. Health Vibes, education, information, and a bit of humor. And not forgetting lots of vibes. Hosted by Carlton Langdo with co-hosts Jacinta Fagan Defo and Trudy Kristen. Jolly's Pharmacy is bringing health and vibes together every Wednesday, so be sure to tune in. Health Vibes every Wednesday on Q95 from 10 a.m. to 11:30. Jolly's Pharmacy, leading the way in healthcare.
Yes, and we are back with you. Of course, this is Health Vibes, Jolly's Health Vibes, with you here this morning. And as I promised, we have a very interesting set of guests this morning, and we have a very interesting topic lined up. So, yesterday was World Mental Health Day, October 10th, and it was observed across the world. And Dominica, of course, no exception to that. And we wanted to continue the discussion about mental health. Mental health as a universal right is the theme, or was the theme, for yesterday's observance of World Mental Health Day. So we want to really continue in that vein and have a discussion this morning about how mental health is a true right of the human being, and what can we really do to ensure that all of us enjoy that right. What are we looking for in terms of mental health, mental wellness, and enjoying the right that we all have to good mental health? And that is what we're going to be looking at. We have in the studio with us two people right now. Casinda Fritz, good morning to you. We have in studio as well Lester Guy. So Casinda, and I'll let her introduce herself a bit more, but Casinda is someone who, very interestingly, is doing advocacy work surrounding mental health awareness with a very interesting initiative, UNICEF and
Let's Unpack It.
Let's Unpack It. So I'll let her introduce herself, and then I will let Mr. Guy, Lester Guy, who is no stranger to Health Vibes. He's our in-house psychologist here on Health Vibes. I'll let him introduce himself next. Casinda, good morning to you.
Hi, good morning. I'm so happy to be here with everyone today.
So let me know just a little bit about the UNICEF Let's Pack It initiative.
Okay, so my name is Casinda Fritz. I am a medical student, and I am the Dominica ambassador to the Let's Unpack It initiative based in Barbados, and we are collaborating with UNICEF.
Ah, okay. All right. So medical student, and this is your interest right now.
Yes, it is.
Nice. Mr. Guy, good morning to you.
Good morning, Trudy and Mrs. Defoe and Miss Fritz. I think I got it right. Yeah.
Yes, good morning.
It's nice to be again on Health Vibes. I'm so used to Carlton and his bubbly side
Ah.
on the show. But it's been a pleasure being with you guys, and I think it's a pleasure being here again. I must say I am really proud of, I think I've interacted with Leona a few times, and I think it's really cool. My son also graduated from the college also on Friday, so I want to congratulate him and so on. But it's good again to be on the show, and as I said, at any moment you call me, I can join you guys and talk on so many different subjects. But I'm glad that today we are focusing a little on mental health, which is again primarily my background. Outside of the fact that I work at the National HIV and AIDS Response Program, mental health is my forte. To an extent. I am a health psychologist, and in addition to that, I've also founded my little business, which is GL Psycho Support Services, and my theme is let's take our therapeutic journey together. So let's do it together. And yesterday I was with a group of people, and as I said, we've moved away from this therapist or healthcare provider focus approach of health, and more on a client and provider focus, where you get the client as involved in the care, in the rehabilitation, in the processes of prevention and promotion of good health as much as possible. Because when you get their commitment, it's so much better. rather than you putting stuff on the table for them. I expect them to follow it.
Right.
So it's a pleasure, and I really like the theme. Again, the theme is centered around so many other health determinants of health that we're having and health conditions, which is the universal human right. And we've been pushing a lot equality and equity more than anything else as it relates to health and how we approach it. So it's a pleasure to be on the show this morning, and good morning to the listening public.
I know the listeners are used to you being on Health Vibes, and there was a symposium that we had to postpone on sexual, on sex. So let's sex it up. And you were one of the panelists that were going to present, and you will still present when the symposium comes back up. So maybe they hear Lester Guy and they maybe think, okay, he's coming to do the let's sex it up presentation. Yes, but you, listeners, you have to wait for that. But today we're talking with Lester mental health and Kacinda as well.
So, Kacinda, tell us a little more about your advocacy for mental health, the activities that you've engaged in. Let the listening audience be aware of how involved you are, if it's with UNICEF. Actually was with UNICEF years ago. And yes, and I know of their great work. So with this being your interest, your passion, tell us a little bit about the work involved and what more we can expect in Dominica here.
Okay, so if we have to discuss Let's Unpack It, we have to discuss the name first. Let's Unpack It means we are demystifying the whole concept behind mental health, right? I believe that we need to have a conversation. Let mental health be something that is not so much of a stigma or taboo, but it should be something where we can have honest and open conversations in our families, at home and at school. And that's the first point of contact of children. And I got involved with Let's Unpack It a few weeks ago, actually. It is an organization that is based in Barbados, and it is based in Barbados right now. And it was founded by a medical student, actually.
Okay, nice.
And since 2020, the organization has branched to psychosocial education, more of advocacy, and involving a lot of youth in basically bridging the gap when it comes to the conversation, and actually involving a lot of non-governmental organizations. So we have done a lot, and recently they actually put a drive out to get regional youth involved in the process, so we can talk to our leaders and our stakeholders in getting involved, and just bringing the whole concept of mental health to be a regular conversation. Let's make it a conversation that everybody can have, and not so much as how it has been in the Caribbean thus far.
Okay, so very good, because our focus here on Health Vibes is health on a whole, but many people tend to focus on the physical aspects of it, not realizing that it's tied in one.
Yes.
And so if someone is not mentally stable, that will impact their physical health.
Definitely.
And vice versa. So it's a 2-in-1. So we have to approach it with a holistic view and mindset. So I'm very, very happy, that you've involved yourself in such an impactful, journey.
Yes.
Not just, in Barbados, but like you said, you're reaching out to other international students or youth, and also government bodies as well. So we are really looking forward to having, those activities here in Dominica and involving more youth in Dominica, because, there's a lot going on in our country right
Definitely.
now. And the youth certainly are being impacted in one way or another mentally, and they may not feel the need to speak out about it just because of that stigma associated with it. But if they see more and more younger faces, hey, we have people around our age who want to make a difference, they probably understand what they are going through,
Yes.
then they'll be more encouraged, to speak out and partake, and also join groups, like the group you're part of as well.
Yes.
I wanted to. We jumped right into the discussion, and of course, it is so important, Cassandra, what you're doing and the involvement of youth. But we jumped right into the discussion about mental health, and we needed to define mental health. A lot of times, there is misrepresentation of the term mental health and a sort of equating it to mental illness. So I wanted to get from Lester, from you, or from Cassandra, a definition for mental health. So when we're talking about mental health and its importance, we know exactly what we are talking about. Yes. So who wants to set the foundation for us?
I will say the foundation.
Uh-huh.
So really, mental health is looking at the holistic person, and we look at aspect. Well, obviously, the absence of mental illness. We look at the positive mental health and mental well-being, positive mental health well-being. So when we look at it, it's something that is very subjective. It is also honing on a psychological, emotional aspect of who you are. Obviously physical also, and we also talk a little about emotional intelligence, which is being introduced a lot more right now in the discussion as it relates to mental health and how you cope. In comparison to what mental illness is, which mental illness, or which sometimes we say mental illness, but they're actually mental disorders, which refer to a wide range of mental health conditions, which would affect your mood, your behavior, your thinking. So you look at it from that perspective. And let me just pull that punch. And I had a pretty conversation with a friend and colleague of mine yesterday. And the person was saying a couple of years ago, they had a biopsy because they had a lump in the breast. And it's only yesterday in conversation, we ended up talking about how that person got into a bit of depression just because of that biopsy, because in the person's head, it's like, my life can change completely. Let's say I have cancer. You understand? Fortunately for that person, it wasn't a malignant thing. It was more benign than anything. But they went through that. And bearing in mind that depression is a mood disorder, yes, which is a mental illness also. So I had the conversation, it's like, it was so simple having the conversation in a casual a casual rapport. And I'm like, how many women go through that, where they may have a lump in their breast and they are fearful that it will be cancer, knowing how devastating cancer can be as an illness right now across the world. But because other people don't know about it and she was able to come out of it on her own, other people are not able to do that on their own. And that is so basic, so in your face. So not, I went to the psychiatric unit or I went to a psychologist or psychiatrist. It's just something somebody goes through normally as an individual who has gone to a medical practitioner and see what happens. Now, I was telling her, you need to have that conversation with other women because they too may be going for the same thing, but we don't have an avenue or a forum for talking about things as basic as that can change your life completely.
And the thing about it is certain people don't realize or understand the downward spiral that can occur. They don't realize that they're disorganized thoughts. They're negative emotions that, that is something to be concerned about. So usually they keep things in, even with men, and the whole realization that, hey, I need to be a masculine man. And if I talk about my feelings, then there's a problem with me. So I think that is a discussion that we need to have on a whole, and just even clinicians letting patients have more of a voice in discussing their mental health concerns.
And that's very good, and that's where the forums are needed, and that's why topics and little programs like mental health, I'm sorry, where we are right now in terms of Jolly's health program,
Health Vibes,
gives the opportunity for us to talk about those things.
Right.
It comes once in a week. Sometimes we'll focus on mental health because it's mental health week or mental health. We'll focus on cancer because it's cancer time. We'll focus on HIV because it's HIV. But if you have this constant bombardment of information to the general public as to where can you get help, where are your stakeholders, who are the people you can reach out to, where can you reach out and get information and so on. It makes it a lot easier for our society.
Right.
And the same somewhat rolls into, let's say, stigma and discrimination with mental health, where the more we know about it, the more we talk about it, more people will reach, and people are feeling more comfortable talking about it. And I think that is some of the things that we, from a healthcare perspective and from a health system perspective, need to look at. There shouldn't be snipers of information, but there should be information given all the time.
Consistently.
Consistently.
And that is the thing about health education. Sometimes people might view health education initiatives as, something trendy, something for a particular list, as you mentioned, a particular day, a particular observance of some day or some week or some month. But it is really something that is necessary for our well-being to happen consistently, because there are so many things that are that we disseminate, via this program and other health education initiatives that save lives.
Yep.
Every day,
Yep.
And when we talk about mental health, people might almost trivialize. When I just said save lives, people might almost trivialize and say, physical health is what would take life, but that is, of course, we know, not true. So I wanted to go then with some of the things, and I want Kacinda to maybe target it from a youth perspective, but some of the things that can impact or deteriorate one's mental health status. What are some of the things, the societal things, or the issues that one may face that may impact their mental health and cause deterioration or cause some sort of negative effect on someone's mental health? Because I wanted to take it from a youth perspective.
So what we're trying to do at Let's Unpack It, we're trying to give youth a voice, right? Because we're trying to say, hey, we can have, as I said, open conversations about these things. There are so many stressors, even for youth. We have school stressors. We were having a live last evening where the representative of UNICEF, Mr. Bertrand Moses, he was letting us know that the data shows that the biggest stressor for youth right now is relational issues. So parental issues, they have issues at school. And he was even pointing out that the data for the CXC examinations, they are lower than they should be. So youth perform at a lower level right now. So if you're telling a 16-year-old right now that they are not performing to regional standard, right, and they have that stressor on them, like, hey, I'm not good enough from such a young age, I feel like that is where we have to look at the measuring stick and be like, hey, is this something that is negatively impacting our youth, or our youth feeling about their future? So that is one of the things that we want to talk about right now, and how it can impact the whole persons, because our youth of today are going to become the adults of tomorrow, right? And they're going to go on the workforce, and even the youth on the workforce right now, what's in place at the workforce, right, to highlight and bring awareness to the issues at the workplace? Are the people being told about mental health? Are they given a voice in the workplace? So these are some of the things that we are very concerned of at Let's Unpack It.
So Kacinda, you mentioned a very important point, that the youth undergo, and they have so many stresses that they undertake. And the way that one deals with stress and the type of stress that one deals with, especially as young individuals, will also have an impact on their mental status.
Definitely.
And so even those who've lived in that era before, they would say, okay, if I had that help, if I had that support,
Yes.
if I understood it better, if I knew better, healthier ways of coping
Yes.
with those stressors, I probably would have not made such irrational decisions,
Right.
or been have a better mental state, and would not impact my relationships, my work, my family, my decision making. And so it's a domino effect.
It is.
And so as a young individual, looking forward to the future, they have to know how to deal with different what different things life throws at them in a healthier manner.
Yes.
There's alcoholism, there's violence, and so people take out their stresses or deal with different mental illnesses if not treated properly in a negative ways. And I'm sure Lester can give a whole list, on that as well. So it's really important that the younger minds recognize when something is wrong with them. They are not they're not interested in the same activities. They're probably lashing out. They have those withdrawal symptoms from their loved ones. They are not performing well at school or at work. And those are hints and symptoms where you need to say, okay, something is up. I need to get help.
Definitely.
And that, somewhat permits us to segue into what emotional intelligence is. And most times I address young people, I stress a lot on making informed decisions. More information that you have, or more informed decision that you make. I no longer even stress on good and bad decisions, because you can make a decision which seems to be bad at the moment and works out for you. It dependent on the perspective of you're looking at it or the circumstances that surrounding you. So you make a decision, but if you have more information, then the decision that you make, let's say to move forward in your career, to get into a relationship, to go and study, to decide what career path you're taking, it's an informed decision based on the amount of information that you have.
Yes.
So emotional intelligence basically is the ability to know and to manage oneself along with awareness and ability to manage one's relationship with others and the environment. And that is what it's about when you talk about where you are. Why do you get to the points that you get to? How the process of, let's say, developing stress or a mental illness comes into play. With a mental illness, there are different factors you look at. You look at the hereditary factors, you look at the social factors, you look at the environmental factors. But it also means that an individual, if you realize, typical example, like marijuana is not for you, then it is not for you. You may try it once and realize, I don't like how my body responded to it. You should acknowledge with your intelligence, if emotional intelligence is not for me. If you realize when you've taken 3 or 4 drinks, you start acting a little outside of the normal, you should realize that, okay, if I'm hanging out with my friends, I need to establish that I can take 2 and that's it.
Yes.
That comes with emotional intelligence, because tomorrow you might take the 3 and 4, find yourself in a situation and you said, you know what, I should have stopped.
Right.
That's where emotional intelligence comes into play. So if, for example, and I make it a little more real, because Judy knows that I always speak real. So you take this 3 drinks, you probably get sexually assaulted. That changes your life completely, which may put you into a depression, which may make you develop something like general anxiety disorder or anxiety disorder. But it came with a decision that you made at a moment that you're not intelligent about. Because a lot of some of this nowadays situations with anxiety disorder and so on is because you may have had traumatic experiences,
Right.
and it falls into that because you don't have the mental capacity to deal with it. And it grows. Sometimes you push it under the carpet, as we said, because mental health is not something that we spend so much time on. And you did have the experience, but you don't want to go and talk to anybody about it. It stays bubbling inside of your head and then it explodes. You have a point.
Yes, but we'll take the call. We'll take the call in a bit. But Lester and Cassandra, from what you both have said, we can see some of the things leading to possible mental health deterioration. I've heard relational issues from Cassandra. I've heard stresses. Lester, you mentioned traumatic experiences. The impact of emotional intelligence. So I am seeing these I would say factors coming into play in what Lester, I also heard you mention, drug use, and maybe potential drug abuse. So I've heard, different things coming through. I wanted to then now ask, how do we protect our mental health? What are some things that we as human beings need to look out for in order to preserve our mental health? So we see what can impact it. What are some of the things we should be doing to ensure that we keep it intact? What can we do? Of course, there's the hereditary aspect that we cannot control, for some mental health disorders. But what can we do as functional humans to preserve our mental health?
Okay, so I want to chime in on this question. I think one of the most important things that we can do as young people is have an avenue in which we can have self-care, right? So for the young men, for example, one of their avenues for self-care is being on the fields and playing football, right? So if we have, and we can have these fields, because I know in my community, of course, we had a big field in Kulibistri, and I believe that if we could still utilize these fields and allow the children to play football, then they would have less of an inclination to be focusing on drugs and on alcohol, for example, in coping with their concerns. So I believe that we can utilize what we have, as I mentioned, the fields, for example, to allow our young people to just free up themselves.
Okay, so so using sports and physical activity
Definitely.
as an outlet, yes.
So again, it's multifaceted, and you have to think of it from that aspect, because let's say, for example, what Ms. Fitz is saying of the football field and so on. Back in my day, every afternoon, all football fields in Dominica have boys playing.
Exactly.
Right now, you hardly see that. You understand? So it means that it's not just an individual thing, it's also a systematic approach that has to be taken into consideration. And I was lamenting the fact that some time ago I was in Suffery and Scott said, and now most of the guys, they're about my age group, and we're playing dominoes and we're enjoying ourselves. But Suffery and Scott said used to be a basketball and cricket community. My community used to be a cricket and football community, and those things have disappeared to an extent. You understand? I remember back in the day, there's no way you're gonna pass Pottersville and not see guys on the field playing football. Nowadays, you hardly see that. In fact, even baseball, I see them playing down of this days. But again, so it means that we have to, the stakeholders, the planners have to put stuff in place from a community-based point of view. Yes, there are the individual things that we can do, and I mentioned about the drug use and so on and so forth. You have to be aware of yourself and know what you can handle. Because if you already know, for example, your family has mental illness, you should already start telling yourself, there are some things that's not for me. Marijuana smoking isn't for me. Alcohol abuse or excessive use isn't for me. If you know, for example, you're going to have a biopsy and you're so scared about it, anxiety is taking over you,